says a clear government strategy should be in place before any further easing of lockdown restrictions. Well, their Chief Executive, Niall Dickson, joins me now. Morning to you, Niall. Good to have you with us this morning.
Good morning.
Just tell us a little bit more then about your current concerns about how ready the government exactly is to go ahead with this new system.
Well, first, as you say, having a clear contact tracing system is absolutely the right thing to do. We support that and the government's determination to set it up, and quite encouraged by what the Prime Minister said yesterday. I think our first concern is that this is being done quite late in the day, and some of the detail has not really been shared with NHS local leaders or indeed, importantly, directors of public health who would have to set up the local plans and the local contact tracing, which should be there to support all this national effort. Now, I think there has been some activity in the last 24, 48 hours around this, and it's certainly true that government rhetoric around this has changed, emphasising more the importance of this local leg of the process, if I can put it that way. But obviously time's quite short, and we need to do this and really get on with it very, very quickly. And we want to see GPs, directors of public health, local health leaders very much involved, and so that they know that their contribution to the national effort will work, because that is when these things work, not just instructions from the centre, but where you get people at local level plugged in and knowing what they're doing and what their part is in the whole process.
Well, indeed. The government, though, is saying that 25,000 contact tracers have been recruited, or certainly they'll be in place. Does that ease concerns at all?
No, that's really the national process that they're putting in place. So these will be, as I understand it, national. If you have symptoms or there's an outbreak and so on, then you contact them, and they will then find out who else you might have been in touch with, and then they will start making phone calls with that. But in addition to that national process, first of all, the app was supposed to be there alongside that, and the app would have enabled you to work. For example, if you found somebody had got infected or had been, say, working in a supermarket and they had infected some other people, you'd be able to find out from the app who they had been in contact with, and you'd be able to trace them through others who were holding the app. Now, the app looks as if the government is not saying when that will be ready, and inevitably with these kind of things there are hiccups on the way, and we understand that, but that was one element. But the third element, so you've got the app, and then you've got this national tracing system. You need to have local tracing as well. So, for example, if you have an outbreak in a factory or whatever else, it's really good to then get the local people who are used to dealing with outbreaks of infection at local level. You get them involved and make sure that they're following that up. You get test results, which if you've got very vulnerable people, again, having boots on the ground and people who may be able to provide them with additional support if they're having to lock down and so forth. So there are lots of ways in which you need to understand how you share data across the system, how you make the local system work alongside the national. And that's the bit we've been worried about, and I think the signs are the government is starting to move on that, but it is going to be, I think, quite a tight and difficult process.
Why do you think track and trace was abandoned so early on in this crisis?
Well, I think they've admitted that in a sense. They didn't have enough tests to keep doing that as the numbers went up, and there is, in one sense, an argument that testing could become less important given you're locking everybody down. So in a way, you're sort of quarantining vast numbers of people anyway. And clearly, if you have a limited number of tests, it was right that they focus on patients who were in hospitals and staff who might be, and we thought that was too slow as well, but they did bring in absolutely staff testing so that they make sure that staff are not put in quarantine when they could be out there working. So I think it was clear. No doubt people will crawl all over this when it's all over, and I wouldn't be too critical in a sense of people at the centre trying to make very difficult and quick decisions at the time. Obviously, if we'd had, like the Germans did, a company like Roche, which had millions of tests and so on that were already in place, then, it might have been easier to keep some sort of contact tracing system going. The important point now, looking forward, is We do have an opportunity to do this. I think you could argue that it should have been planned a bit better and over a longer period of time before now. But looking ahead, important just that you join up the local and the national and the regional. There are different tiers of this, and making a complex system like this really work requires every single part of that system to know what they're doing, to contribute to it, to understand how it'll work, and for people locally to apply a local context.
And just to clarify, and finally, Niall, you've actually put all these concerns in a letter to Matt Hancock, is that right?
We have, yes. We've set out the points that we want, and indeed we want to be constructive about this. I think the health service and indeed local authorities absolutely want to be part of this. So it's a plea. We just need to work together on this, and that absolutely includes, and centrally, I think, the directors of public health who sit within local authorities.
Niall Dickson, really appreciate your time this morning. I know you're a very busy man. Thanks very much indeed for joining us here on LBC News. Niall Dickson there, Chief Executive at the NHS Confederation.